Your doctor told you to never squat again. And you know what? They might be wrong. I know that sounds bold, maybe even irresponsible. But after more than a decade working with patients over 60, people with osteoarthritis, bone-on-bone diagnoses, and surgically repaired knees, I can say with confidence, the blanket recommendation to avoid squatting is one of the most harmful pieces of advice we give older adults. Not because doctors are bad at what they do. That's not the issue. The problem is that research has moved forward, and clinical guidelines haven't fully caught up. And here's what I see in my clinic every week. Someone comes in who has avoided any knee-bending movement for years because their doctor told them to, and their knees? Weaker, stiffer, more painful than before, because the muscles that protect that joint have been quietly losing strength. So in this video, we're going to do something most health content refuses to do. We're going to look at both sides honestly, the real reasons doctors warn against squatting, and the real evidence showing that controlled squatting may be exactly what your knees need. And by the end, I'll give you a clear answer, not a vague, it depends, and goodbye. A real answer, with 3 specific factors that will show you exactly where you fit. Stick with me, because what you're about to hear could completely change the way you think about your knees. You'll discover the 3 biggest squatting mistakes and what you can start doing today to improve that knee pain that's been following you around. But before we continue, tell me something in the comments right now. Have you ever been told to stop squatting? Type yes if you've been told to avoid it, or no if no one has ever brought it up with you. I want to know who I'm talking to today. And while you're commenting, let's start by understanding where all this fear comes from. For decades, squatting was treated as the #1 enemy of the knee, and there was a reason for that. In traditional orthopedic medicine, the logic was simple and straightforward. A bent knee means increased pressure on the joint. Increased pressure means wear and tear. Wear and tear means pain. So, eliminate squatting. Eliminate the problem. That line of thinking dominated medical offices for more than 30 years. And for patients who came in with acute pain, the advice made sense in the short term. Rest, reduced load, anti-inflammatory medication. It worked, at least to stop the immediate flare-up. The problem is that short-term advice became a permanent rule. And that's where things start to go wrong. Because the knee doesn't function in isolation. It's supported by a network of muscles, the quadriceps, hamstrings, and glutes, that stop protecting it when they stop working. And when those muscles weaken, the joint itself ends up absorbing a load that should be distributed across the entire muscular system. In other words, avoiding squats for too long can create the very problem you were trying to prevent. Over the last decade, evidence-based physical therapy has changed this conversation significantly. Studies published in journals such as the British Journal of Sports Medicine and the Journal of Orthopedic Research have shown that controlled, progressive, and properly guided movement does not worsen osteoarthritis. In many cases, it may even slow its progression. But this knowledge still hasn't reached everyone. Now let's look at both sides of the story and what you can do with your squat technique to finally start improving that knee pain that's been following you around. The arguments against squatting after 60 do exist. They're real, and I would be dishonest if I pretended there were no scientific reasons behind them. There are. When you bend your knee beyond 60 degrees, the force placed on the patellofemoral joint, the area between the kneecap and the femur, increases significantly. In people with advanced degeneration in that region, this increase in pressure can trigger inflammation and pain. That's not a myth. Another situation that requires caution is advanced stage osteoarthritis. When the cartilage is severely damaged, the reduced joint space leaves the bone surfaces more vulnerable to impact. And the most serious situation is the so-called bone-on-bone diagnosis. If you've ever heard that phrase in a doctor's office, you know how alarming it sounds. And when the cartilage is nearly gone, restricting certain movements may make clinical sense depending on the individual case. So why am I saying your doctor might be wrong? Because none of these 3 arguments justify a blanket, lifelong ban on squatting for every person over 60. What they do justify is caution, progression, and individualization. And that's exactly where most recommendations fall short. Not because of what they say, but because of what they leave out. They tell you what to avoid, but they don't tell you what to do instead. And that silence comes at a huge cost for people who stay inactive, waiting to get better. Now let's look at the other side. I'm about to show you what the latest research is saying. And get ready, because this goes against almost everything you've probably heard until now. The first piece of evidence is about the muscle that does the most to protect your knees. There's a muscle on the front of your thigh called the quadriceps. It's primarily responsible for absorbing impact and distributing force before it reaches the knee joint. When this muscle is strong, it acts like a natural shock absorber. When it's weak, the joint takes the full hit on its own. And guess what? One of the best exercises for strengthening the quadriceps is the squat. Research published in international scientific journals shows that arthritis patients who performed controlled, progressive squats reported less pain and greater mobility after 8 weeks compared to those who remained inactive. That's not an opinion. That's data. The second piece of evidence has to do with range of motion. Here's something that changes everything. A deep squat and a partial squat are two completely different things when it comes to knee stress. A mini squat, where you only lower yourself slightly as if you're sitting down onto a tall chair, places only a fraction of the pressure of a full squat on the knee. They're different movements with different impacts. When a doctor says, "Don't squat," they're usually thinking about a full gym-style squat, not the controlled, functional movement commonly used in physical therapy. The third piece of evidence is the one that matters most in your daily life. Do you know what a functional squat is? It's getting out of bed. It's standing up from a chair. It's using the bathroom. It's picking something up off the floor. Every one of those movements uses the same muscles involved in squatting. If you avoid squatting completely, you're training your body to fail at the most basic activities of daily living. And that loss of independence, not being able to stand up on your own, is one of the biggest factors affecting quality of life after 60. Movement is not the enemy. Poor movement is. And now it's time for the answer you came here for. Can you or can you not squat after 60? The honest answer is, it depends. But I'm not going to leave you with just that, because it depends without an explanation is useless. So let me give you the 3 factors that determine exactly where you fit. The first factor is the degree of joint degeneration. If you have mild to moderate osteoarthritis, and most people over 60 fall into this category, controlled squatting is not only safe, it's actually recommended. The research is very clear on that. Now, if you have severe osteoarthritis with constant pain even at rest, then the movement needs to be modified and closely monitored, not prohibited, modified. The second factor is the size of the movement. Remember what I said about mini squats? This is where that distinction becomes a game changer. Going down only about 1/3 of the way, as if you were sitting on a very tall chair, is completely different from performing a deep squat. For most people over 60 with knee pain, the mini squat is safe, effective, and functional. That's where the journey begins. The third factor is how you perform the movement. And this is the one most people ignore. You can do the right exercise with the wrong technique and end up getting hurt. Knees traveling excessively past the toes, poor weight distribution, a rounded back. These posture mistakes place unnecessary stress on the joint, and that's when squatting can become a problem. But before we continue, I need to tell you something many people don't realize. Sometimes the pain you feel when trying to squat has nothing to do with the knee itself. It has to do with leg muscles that have become so weak they can no longer support the movement properly. The knee hurts because it's carrying a load that should be shared with the quadriceps, glutes, and calves, and those muscles simply aren't doing their job. The good news is that this can be fixed. When you strengthen those muscles, even before returning to squatting, the pain decreases. Sometimes it disappears completely. Not because the knee changed, but because it finally has the support it needed all along. If you want to learn exactly how to strengthen those muscles from scratch, I have another video on this channel that walks you through a complete step-by-step protocol. You'll see it on the screen right now. Make sure to watch it after finishing this one. It's absolutely worth it. Now back to our topic. If your joint degeneration is mild or moderate, if you're performing a small controlled movement, and if your technique is correct, then squatting is not your enemy. It may be the exercise that gives you back your strength, stability, and independence. And now comes the most important part of this video. I'm going to show you 3 squat variations. Each one is a step on the ladder. You start with the version that matches your current ability and progress at your own pace. No rushing, no pain, no unnecessary risk. Before we begin, here's one golden rule. If at any point you feel sharp pain, a sudden stabbing sensation, or a feeling that your knee is locking up, stop immediately. Mild discomfort is normal when you're reactivating muscles that haven't been used in a while. Severe pain is not a sign of progress. It's a sign to stop. Version 1, Wall Mini Squat. This is the safest variation, and it's where most people should start. Stand with your back against a wall. Place your feet about hip-width apart. Now slowly slide your back down the wall just a little, as if you were sitting on a very tall imaginary chair. Lower yourself only about 6 to 8 inches, 15 to 20 centimeters at most. Hold for 3 seconds. Then slowly return to standing. That's it. Simple as that. Perform 10 repetitions, rest, then do another set of 10. Start with 3 sessions per week. It may not seem like much, but for muscles that have been inactive, this is real work. Version 2, Sit to stand from a chair. This is the most functional variation because it's exactly what you do dozens of times. Place a chair behind you. Stand in front of it with your feet hip-width apart. Slowly lower yourself as if you're going to sit down. But stop just before touching the chair. Hold that position for 2 seconds, then sit down. After that, stand back up slowly, without using your hands if possible. The secret is in the controlled descent. That's where the muscles do the real work. Do 10 repetitions, 3 times per week. When it becomes easy, try not to touch the chair at all. Lower down, hold, and come back up without support. Version 3, Supported Free Squat. Once the first 2 variations feel easy and completely pain-free, you're ready for this one. Stand while lightly holding the back of a chair or a countertop, just for balance, not to support your weight. Place your feet hip-width apart, with your toes turned slightly outward. Slowly lower yourself, keeping your knees tracking in the same direction as your toes, going only as far as you can without pain. You don't need to go very deep. Then rise back up with control. At this stage, the movement is more natural and closer to a full functional squat, but still performed safely. The 3 mistakes you need to avoid in any version. The first is letting your knees cave inward. When your knee collapses toward the opposite foot, the pressure on the joint increases dramatically. Always keep your knees aligned with your feet. The second is descending too quickly. Speed takes the work away from the muscles and shifts the stress directly onto the joint. Always lower yourself under control. Take at least 3 seconds to go down. The third is holding your breath. It may sound minor, but it makes a difference. Breathe normally throughout the entire movement. Exhale as you come back up. With these 3 squat variations and these 3 key precautions, you have everything you need to get started safely. The truth is that a controlled squat, performed correctly, can be one of the best allies your knees have after 60. It strengthens the muscles that protect the joint. It preserves your mobility. And it helps maintain your independence when it comes to life's simplest activities, standing up, sitting down, walking, and moving around without relying on anyone else. Remember the 3 factors: the degree of joint degeneration, the size of the movement, and the way you perform it. Those are the factors that determine what's safe for you. Now tell me in the comments, which of the 3 versions are you going to start with? Type 1, 2, or 3 below. I'd love to know where you are on this journey. If this video helped you, give it a thumbs up. It makes a huge difference in helping more people like you discover this content. And if you haven't subscribed to the channel yet, make sure you do. New videos are released every week, always practical, always evidence-based, and always created with you in mind. See you in the next video.